Welcome to Kids Considered, where two pediatricians discuss children's health topics of interest to parents in a podcast with new subjects considered every episode. I'm Dr. Lena Vanderlist.
And I'm Dr. Dean Blumberg.
And we're both pediatricians at UC Davis Children's Hospital in Sacramento, California.
You know, when we were talking about addressing this issue, it's so important. We had so much to talk about that we thought this would be important for a two-part episode. And so this will just be part one, and then we'll finish up with an episode that we'll have coming out in 2 weeks.
Hey guys, I'm Mr. Patel and I have a 3-year-old son. With the recent protests relating to racial inequality and police violence, I was wondering what is an ideal age to talk about the subject of race and color with my son, and what are some resources to do that in an age-appropriate way?
Great. I think this is such an important question and, of course, has been an important topic for decades, but is moving to the forefront of the conversations these days in the settings of the Black Lives Matter protests that have been going on all across the country.
And we know about the recent tragic killings that were shared widely on social media of George Floyd, of Ahmaud Arbery, of Breonna Taylor, and other Black individuals. And the communities have come together to resist systemic racism and police violence against people of color.
Right. These demonstrations have been extremely powerful, and communities have joined together to acknowledge the problems of both individual and institutional racism and try and work to find solutions both on an individual level, so us working to learn more to address our own personal biases, and as well as on a systemic level, like fighting for policy changes.
And because of how widespread these protests have been, many children have seen people protesting, and they're curious what they're protesting about. Some teens may have seen the videos on social media and maybe participated in the protests. And many parents are asking, how can they raise their children to be aware of racism and white privilege while also learning the importance of treating everyone fairly, regardless of skin color or cultural background?
Right. And I know that most of our listeners know that Dr. Dean and I are both white physicians from more privileged position of never having to experience racism firsthand. And so we definitely don't consider ourselves anywhere close to experts on this topic and have a lot of work to do on our own to learn. So we invited one of our colleagues who has more experience with both being a Black male physician as well as closely working with youth from marginalized backgrounds. So Dr. Mikah Owen, thank you so much for joining us today to talk about this really important topic.
Thanks for having me.
So Dr. Mikah Owen is a general pediatrician here at UC Davis Children's Hospital. He's a community health advocate. He graduated from University of California, Davis for his pediatrics residency. And I remember working with him then, and the wonderful grand rounds that you gave on ACEs that we've talked about, the adverse childhood experiences in an earlier podcast. He did his fellowship at the University of Florida, Jacksonville in community and societal pediatrics. And he has been involved in working with youth in the criminal justice system as well. Wait, was I supposed to not say criminal justice system?
Juvenile.
Yeah, that's a great point. I think with kids, we talk about the difference between like the criminal justice system and the juvenile justice system. The juvenile justice system is separate and apart from the criminal justice system, and that's because developmentally, children and adolescents are very different from adults, and their needs are very different from adults. Somewhat related topic, but kids can go into the criminal justice system, which is the justice system that we kind of hear about with adults. But first, they usually will go to the juvenile justice system. And if they're going to be transferred to the criminal justice system, there's usually various mechanisms they have to go through in order to get there. And we advocate that as much as possible, kids be kept in the juvenile justice system as opposed to the criminal justice system.
Right. Thank you for that. So theoretically, the juvenile justice system is designed to meet the needs of children and is more appropriate for them. And Dr. Mikah Owen's also worked with foster care. He's passionate about population health for children and adolescents from marginalized backgrounds.
And one of the last times Dr. Owen and I were together, we were holding up signs at our Sacramento White Coats for Black Lives protest. Dr. Owen, I'm just curious, how have the last few months been for you, both as a Black male and as a parent of, young Black kids? I mean, are you feeling inspired by what's going on? How are you feeling?
I don't know if inspired is the word I would lead with. More so, I think it's past frustration and I think to kind of outright anger.
Yeah.
For many of us who've seen the videotape, I think it was just heartbreaking and devastating. And I think there is some inspiration in the fact that in some ways this time seems to be, different and prompting some more serious discussion about, police violence and about what the experience of African Americans are in this country. But I think for many of us, a lot of the anger and the frustration is that, these episodes aren't new. And we talk about it a lot because I think we caught this one on camera. Same with the Ahmaud Arbery. We caught it on camera and it was so devastating to see on camera that it triggered a discussion. But I think, for centuries and for generations that Black people have been kind of talking that this is a real thing and this is happening. And I think another real point of anger and frustration is it feels like, I think for many African Americans, that if it's not caught on tape, it doesn't have the same kind of impact.
I was just going to say, you don't want to live your life with your cell phone camera on or your phone out waiting for something to happen.
Yeah, I just think that's an important point because, what we're talking about is these incidents that were caught by video, but that's the tip of the iceberg, right? Because there's incidents like this that presumably happen all the time that people didn't have a video of. The cell phone camera wasn't on. There wasn't a surveillance camera or something on.
Yeah, absolutely. And I think it's the tip of the iceberg and murder is at the end of the spectrum. But we don't really have a lot of data or know a lot about, other acts of violence or other acts of oppression that are experienced by Black people that don't end in murder that's caught on camera. And I think that, Black people have been saying that these things happen very, very frequently. And they haven't always been believed. And it feels like if it's not caught on camera, the discussion and the narrative is a lot different.
We mentioned the term structural racism and institutional racism. And can we define these terms? Because I get confused sometimes by what they're specifically referring to.
Yeah, I think structural and institutional racism are similar. There's individual/interpersonal racism and then structural and institutional racism. So individual racism could be that, judgment, bias, stereotypes or generalizations that people have about other people that are based on race and ethnicity. And it can manifest itself in various ways, sometimes with illegal discrimination, sometimes with violence, and sometimes with microaggression. And then there's structural and interpersonal relationship, which is more of the kind of interplay of the policies, practices, and programs that institutions have, or the historical and ongoing policies and practices that kind of create and maintain inequity in between races and ethnicities.
Yeah, I always think of one example of institutional will be, medicine. All of our profession has not been great at dealing with institutional racism in the past. So you always think about the wall of white men, which is the picture of all of the past deans of the medical school and I'm not making an overarching comment, but typically most medical schools or institutions will have this wall of old white men. And that may be just more of an act of institutional racism, that you have not seen people of color or women or other people rise to these high positions in the past.
And I think that's a great point because it is really, really related to structural racism as well, because there's all these kind of structural issues and historical policies that have led to that kind of institutional result that you just described. So there's all these advantages that those individuals have accumulated over time that still persist. that kind of drives inequities going forward. And I think community violence and what we're seeing, police violence and what we're seeing with the COVID pandemic are all great examples of how structural racism manifests itself.
Yeah. And then for individual racism, you mentioned personal bias. And obviously, this is something that's learned from a young age. So I think during our discussion, we'll talk about how we may be able to help kids minimize their risk for individual racism and bias. But you also mentioned something like the term microaggressions. Do you mind defining that for our listeners?
Microaggressions could be things that maybe are not like an outright rude or disrespectful comment to someone, but comments that are really offensive or kind of geared towards someone's race or ethnicity in an everyday environment. So I think many Black people in the workplace have kind of experienced like comments about maybe their body type, how they wear their hair, what kind of food they eat, things that, are meant to kind of be insults to us that may be part of our physical appearance, maybe part of our culture, maybe just part of some of the different norms in our cultural experience that are kind of used and weaponized in the professional environment to make us feel uncomfortable, make us feel unwelcome, and create an environment in which we don't, have the same opportunities to thrive as some of our colleagues.
Like, so when you're saying like, oh, your hair is so cool, like you wouldn't say that to like me with short blonde hair. And so when you're saying that over and over to a woman of color, is that an example of a microaggression?
Yeah, it could be. Or I've had women of color colleagues or people in front of, a group might ask to touch their hair or, touch a part of their body in a way that they would not do to white people. So I think that is a great example and that people may experience, somewhat frequently in the workplace.
Well, as pediatricians, I think it's important for us to give a background of how we see the impacts of racism in children's health specifically. So right now we've talked about sort of the systemic racism and individual racism across adults, but there are, lots of studies looking at racism and how it affects children's health.
Yeah, absolutely. I think that the bottom line of those studies is that the impact of racism is really, especially structural racism, is really pervasive and really can shape a young person's life in a numerous amount of ways. So, it kind of impacts where you live and the kind of housing you have access to. It impacts what you eat, whether you have access to like fresh foods and vegetable. It impacts the quality of your education and how much access you have and what kind of resources that you have if you're struggling in school. It impacts, the amount of policing in your neighborhood and whether or not you're more likely to have interaction with police because of the number of police that are present. So I think that, it's really hard to overstate the impact that structural racism has on the health, well-being, and development of children. And as pediatricians, we know that kind of childhood sets the foundation for the rest of your life. And the experiences and environment of childhood are going to have a profound impact on your long-term health, your long-term well-being, your developmental trajectory. And structural racism really does kind of set that developmental point kind of lower and makes it such that these kids have a lot more that they have to overcome in compared to their colleagues or their peers.
So you talked about a lot of the societal issues, but we also talked about some of the environmental issues that the structural racism leads to that lead to medical issue. I mean, racism is a medical issue. It's not just a societal issue. I mean, the racism will lead to increased obesity, increased rates of asthma, crowding, so maybe increased infections, all those things. So this is a medical issue we're talking about, not only a societal issue, correct?
Absolutely. And I think it's really important to phrase it like that because as a pediatrician, I totally agree that's a medical issue. And since it's a medical issue, as pediatricians, it's our job to promote the health and well-being of our patients and children in the community, which is why I think we're kind of seeing more and more physicians start to speak on structural and interpersonal racism as a social determinant of health and call for changes kind of in the clinical setting, but also in the non-clinical setting to improve outcomes and really achieve equity in health and well-being among our children and among our society.
So I can tell you within my specific specialty community with infectious diseases that on some online discussions, when people brought up that this is a really important medical issue that we need to address and have not addressed in the past, we've ignored it for too long, there was a lot of pushback, and a lot of the infectious disease people said stuff like, oh, why are we talking politics, is what they would say. And then there was, a secondary response to that is like, we're doctors, we care about patients, this affects their health. We need to speak to this issue because it's a health issue also.
And I'll just follow up on that by saying, I think it was the Pediatric Infectious Disease Society, correct me if I'm wrong, but they put out an incredibly powerful statement to me as a Black person that acknowledged that Black men were more likely to die at the hands of police than they were from COVID. And that was in response to some of the protests that were going on. And as a Black pediatrician, that was incredibly meaningful to me, because I think many of us have often felt that, maybe the medical community or the professional organizations aren't recognizing the lived experience of some of their patients. And I think that was a great example of the tide hopefully starting to change. And that statement I thought was very powerful and very honest.
And I think that it's important to highlight, really, these changes, as we've talked about, are not due to any genetic differences. So in medicine, you learn things like, Blacks have a higher likelihood of developing hypertension. And that, again, goes back to individual and structural racism and not a genetic predisposition for developing these conditions. And so it's just important to highlight, again, all of these medical problems that we see a higher percentage in Black communities are due to this underlying racism and not a genetic difference. There's no genetic difference.
Yeah, I think that's also a great point. And, I was in med school from 2007 to 2012, and even as soon as then, there was a fair amount in the curriculum that spoke about race-based differences. And there's a real movement in the medical community now to kind of eliminate those, race-based references. Like GFR is a big one that I've seen, and
right.
that they're not really explained by differences in race and ethnicity. They're explained by other factors. But I think there's examples of that kind of structural racism being propagated over time and not being addressed until now.
Yeah, so you mentioned GFRs. We should just spell that out. That's actually, Dr. Lena should explain that. That's glomerular filtration rate, right?
Yeah, it's just a marker of kidney function, is what we were talking about. So,
but they do mark on the lab reports. They say they have two normal ranges.
Yeah.
Right.
Yeah.
So they have range for Black, and they have the other range, right? So I never paid attention to that because it's not my area of expertise.
Yeah, and many institutions now, they stopped doing that and have advocated for any kind of markers like that or any marker like that to be eliminated and removed because it's not, scientifically valid.
So you had mentioned the statement that was talking about how African-American men are more likely to die at the hands of police than from COVID, which I think is a very powerful statement. I was hoping we could talk a little bit about the impact of police violence on people of color and why it is a public health topic.
Yeah, I think there's a couple. Number one, just the sheer numbers. There's a study that says right now, like 1 in 1,000 Black men can expect to die at the hands of police violence, which, a mortality rate of 1 in 1,000 is a public health crisis. And then I think when we talk about the impact of police violence on people of color, I think there's the obvious and immediate ones, the being a victim of violence and what that means for your personal life, and witnessing or experiencing violence and the mental health outcomes and the anxiety and worry that may come with it when you see it directly. But I think it's much more pervasive than many people may realize. So I think a great example of this, there's a video on social media that went viral of a young black male playing basketball in his front yard. And then he looks kind of to the side, and then he ducks and hides behind a car. And then you see a police car driving by. And when the police car driving by, he kind of looks around to make sure it's gone and then starts playing again. And I think that's really indicative of kind of how many black children live in a state of fear. And if you fear the police, who do you go to if you're being abused and you don't feel safe? And also, I think African-American parents have long known that the risk is different for black children. So, many black children have had that we call the talk, where your parents or your grandparents kind of talk to you about how to navigate a world that's unfair. How do you respond if a police officer is being aggressive to you, or if someone else is being aggressive to you, and how to make sure that you're not presenting yourself as a threat. And I think there's a lot to unpack there. But to summarize it, I think that parents feel like they have to raise their children in a way that protects them from a real dangerous world, a real unfair world. And it kind of really changes how you interact with your child, how you parent your child, how you prepare your child. And I think it could end up manifesting in a lot of different ways. And I certainly don't blame the parents, because I think it is true that is a world that, many black children experience. But it's just a kind of a very pervasive impact on the lived experience of black children and the lived experience of black parents. It's really challenging.
We have had a separate podcast on adverse childhood experiences and have talked about like the stress response, right? Like the cortisol goes up, and in the end, that's the thing that ends up damaging blood vessels and leading to all of these other things. And, you look at that video of that little boy and you think, yeah, his stress response went up. And if that happens every time you see a police officer, it just goes back to that whole, again, systemic racism causing health problems and as well as mental health problems. There was a really interesting study that was done surveying communities after a police killing, and it really showed that there are significant mental health outcomes even for people that witnessed it as bystanders or on the news in that community. And they found it to actually be close to the mental health burden of someone with diabetes, which we know is like a huge disease that many people can think of. So it does affect not only the person, but the community around them as well. So we will continue this really important conversation with Dr. Mikah Owen in part 2 of our 2-part series on racism and discussing racism with children.
That wraps up this episode of Kids Considered.
You can find more information on our website, kidsconsidered.ucdavis.edu.
Follow us on Twitter at Kids Considered.
And Instagram at Kids Considered.
If you have feedback on this show or topics you would like us to discuss in the future, we would love to hear from you.
Please call us. Our number is 916-915-3388.
Or email us at kidsconsidered@gmail.com.
Please rate us on iTunes or wherever you subscribe to your podcasts.
Thank you for listening, and we hope you will join us for our next podcast.
Kids Considered is sponsored by UC Davis Children's Hospital.